Okay, simple muscle curve. So this is A to B, it is the latent period. So if you are not there and have not gone through it, then how will you understand today's class? You won't, that is you won't. You don't know, so you won't. You don't know whatever is going on. Which nerve and muscle are taken? Sciatic nerve and gastrocnemius muscle. This nerve muscle preparation is taken. Amphibian experiment should do because the frog is chosen because it is convenient to handle, its viability is good, it is available throughout the year. These are the reasons we choose, but actually we do not. It actually, more or less due to some ethical issues, these experiments are less done nowadays. So the total experimental setup is actually not required for you also, for even from the exam point of view. So there is a lever system which draws these curves on the something called the kymograph, a rotating drum. This is called the kymograph. A lever system is there which is mounted. So there is a mounting system for the nerve and muscle preparation, and whenever the muscle contracts due to electrical stimulation, it is done with a Dubois-Reymond induction coil. So see the just names and the diagrams from the books. How does it look like? Sometimes they come as a OSPE type of question, just what is this instrument, what it is used for. So that is given for the stimulation. So the nerve and muscle, if the nerve is stimulated, then the muscle contracts. That muscle contraction is recorded like this. The lever is drawing this. So the point of stimulus is A. The point of stimulus is A, and the contraction is starting from B. This is the part is the phase of contraction, B to C, and this is the peak of contraction, reaches this, and then again it comes down. This is the phase of relaxation. So you will be asked what is AB, that is latent period. Okay, then BC is contraction period, CD, and what is the cause of this small curve? What is that called? Physiological curve, but that has nothing to do with muscle physiology. Actually nothing to do, type of misnomer, that has nothing to do with muscle physiology. It is due to the inertia of lever. It is actually due to the inertia of lever. The lever, that due to the inertia of lever, that small curve is drawn. লিভারটা এরকম ভাবে গেছিল বলে আরেকটা ছোট কার্ভ ওখানে হচ্ছে, that has nothing, that is no contraction and relaxation. And below is the time tracing. Time tracing is done, what is used? The tuning fork of 100 hertz is used for that purpose. So if temperature rises, what happens? The muscle starts to contract earlier and the height of contraction is more. If temperature is lower, then what happens? Then the height of contraction less and the latent period is more. That is, it starts to contract later. Okay, so that is what is shown here. So you have to compare. Usually what we told, that there will be three curves together in the graph as it is given, I think in many books. I showed that book, the book by Dr. A.K. Jain. The curve is given 40 degree centigrade and also, or 36 degree centigrade and 16 degree centigrade, 40 degree, 10 degree centigrade. So you have to mark that this is the, which is at room temperature, this is at higher temperature, the latent period is less. So instead of B, there here B1, B2, there will be three latent periods, say designated as B1, B2, B3. So which is the shortest? That is, shortest latent period is at higher temperatures, and the longest latent period is at cooler temperature, and the in between is, that is at normal room temperature. So this is one as normal. So these will be combined. This and this can be combined in the, both of these can be combined in the same diagram. So very few marks are there in from your exam point of view, and these things will be just, you will ask to identify and maybe the physiological cause behind that. So you have to say the changes what occurs in a muscle if temperature is higher or lower. That is theoretical, which you have already have discussed in the, has been discussed in the nerve muscle theory classes. And if one muscle, if same strength stimulus is given one after another. So when separate contraction or the height of contraction rises when it is in the after the relaxation period, just after the relaxation period of one contraction, just after the relaxation period. So just after this phase is a second stimulus of same strength is given, then the next in the next contraction amplitude will be higher. This is still visible if it is even given during the contraction period, but not visible if it is given during the latent period, especially the first half of the latent period. Then the muscle is then at that time it is unresponsive. This is what is shown here. So see the second one. Second one means second of this one. Is it labeled? No. So simple muscle twitch. Next one is in the after the relaxation period. So the height of contraction of the second curve is more. That is a separate. It is seen as a separate simple muscle twitch. It can be somewhat seen even if it is given in the contraction period, but not in the latent period. Latent period is the not especially the first half of the latent period. Then it will show as a single curve. But the key word here is same strength. Second stimulus is of same strength. Okay. Second stimulus is of same strength. If it is of increasing strength, then and that is at make or break. So again, the theoretical arrangements of the experiment is not that needed that much. If it is of increasing strength, that the amplitude of contraction is shown, that max one stimulus, if there is minimum stimulus, no contraction. If there is what is called the threshold stimulus, the stimulus just at which the just contraction just starts to occur. Now the strength of the stimulus is increased. Okay, now the strength of the stimulus is increased. In the temperature graphs, what we say, same strength stimulus, we have to note these differences, I should not say differences, to note these observations. When we note the effect of temperature, other factors have to be constant. So effect of temperature, that is also same strength stimulus. Strength of stimulus is given at say 30 degrees centigrade, but same strength at 40 degrees centigrade, same strength at same degree, then only we can compare. So here we are noting the effect of increasing strength. So the temperature is not varying, temperature, all these stimuli will be given at the same temperature, other factors remaining constant. Otherwise, if everything vary, then we can't note the observation, the change in observation is due to which factor, we can't just identify. So same temperature and other conditions remaining constant, strength is increasing. So what will happen? The amplitude of contraction increases, but till a certain point, that is after one stage will be seen when even after increasing the strength of the stimulus, the height of the contraction is not increasing. The physiological basis for that is that all the motor units have been recruited, and muscle physiology follows on none law. Once a motor unit has been recruited, that works to its full potential. So say motor units, say 30, 50, 100 motor units are being recruited. So only after 100th motor unit, or they say the 75th motor unit will be recruited only when all the 74 or the previous one has exhausted its full potential. So after that, even after including the syllabus, when all motor units have been recruited, that is no more strength of stimulus, amplitude is not rising. That is called, so that those stimuli will be just named as supramaximal stimulus. And what is named as the maximal stimulus? We are defining the maximal stimulus by the lowest strength of this among the maximal and among these stimuli, which are causing the highest amplitude of contraction. The lowest among that is called the maximal stimulus. Just naming this, we are calling this is the maximal stimulus which is causing this highest contraction. How we will know the highest contraction? After increasing the strength of the stimulus and seeing that okay, no more contraction amplitude of contraction is not getting increased. So that is strength of stimulus increasing, and what happens to the amplitude of contraction. So this is not the beneficial effect. Which is the beneficial effect? Beneficial effect is the same strength of stimulus, second stimulus, that is the beneficial effect. And this is what can be shown in these. First, due to the beneficial effect, after the relaxation period, the height of contractions is rising, but then muscle becomes fatigue, and the first sign of fatigue is at the neuromuscular junction, and even this can be demonstrated experimentally that nerve itself is not fatigued. If experimentally it can be done that the nerves are two nerve muscle preparations are taken and one is crossed over, and there is a piece of block of ice is kept on the part of the one nerve. So that is seen even after keeping the block of ice, that is transmission to the nerve is blocked, and we compare two separate observations we make. So after removing the block of ice, it can be shown that the nerve is not fatigued. Site of fatigue is not the nerve. So whenever we are working, so sometimes the site of fatigue, one site of fatigue is considered. The psychological fatigue also is so called the one site of fatigue. But primarily the site of fatigue there is the neuromuscular, and the fatigue is occurring at the neuromuscular junction. And as fatigue goes on, when the muscle becomes fatigued, then the amplitude of contraction will be decreasing. Even after increasing the strength of the stimulus, the amplitude of contractions will be gradually decreasing. That is the genesis of fatigue. But if the increasing frequency even of the same strength of stimulus, what we said last day, increasing frequency, then what happens? The muscle first goes into a state of increasing frequency of stimulus. Frequency means very short intervals between same strength. We are not allowing, not relaxation period, nothing. Oh, that is not there here, still not there. So just see your books that find the topic genesis of tetanus. It is called tetanus. Clonus, trepi, clonus and tetanus, one after another. After the beneficial effect, this is which edition? Fourth. See the contents. Find the contents, the page number. Have you opened this book earlier? Yes, this one. So just let me show once. This one, whichever book you read, this picture, this type, that means it will exactly be not the same in all books. So this one, this chart is not there over here, so I have to show the book. So trepe, clonus and tetanus. When the incomplete tetanus, difference between clonus, incomplete tetanus and complete tetanus. Okay. Sustained contraction. So relaxation is increasing frequency and all this what we say, all this. So what is obvious? This latent period is 0.01 second. So all these are experimentally done. Manually we cannot increasing frequency. So we cannot, this is manually not possible to measure. So all these are experimentally set up earlier. Increasing frequency of stimulus will be given. So this cannot be experimentally done. That is genesis of tetanus, genesis of fatigue and genesis of tetanus. What do you mean by preload and afterload? At least you say in the tell in the context of cardiovascular physiology. What do you mean by preload? End diastolic volume is the preload. We call that the preload. That means the muscle has already when already a load is acting on a muscle before. So muscle has series elastic components and contractile components. Already the muscle has gone into a state of partial contraction before the actual contraction. The muscle is already stretched before actually. We should not say like that, partial contraction. Muscle is already stretched before the contraction, then that helps the muscle, that helps muscle contraction. That is what is the preload arrangement already. But if the muscle starts to contract only after the load is given, then it is called the afterloaded type of arrangement. Like say example of in daily life or practical life is it picking up a heavy object from the ground. Heavy means an object from the ground. Then the muscle is starting to contract before that there is no stretching of the muscle. The stretching occurs only after contraction the stretching occurs first only after the load is put. But when the muscles which are maintaining posture against gravity, these are examples maintenance of posture and against gravity, that is example of preloaded condition. So the muscle contraction is better in those cases, and you have to just understand this theoretically. So the graphs will look like this same. So the amplitude of contraction is more in case of preloaded condition. So only this graph will be shown. So obviously things will not be written, you have to explain yourself. That same, say for a 10 gram weight or for a 20 gram weight or for a 30 gram weight, same load 30 gram mass suspended. If it is a after loaded condition, then amplitude of contraction will be lesser than in preloaded condition. Okay. So that is what is to be, not to be demonstrated by you, but just to be explained. So this is again same thing, genesis of fatigue, and this one looks differently, but anything will be given, anything. If you see the height of contraction, if just one direct stimulation of the muscle is labeled, so this is the first. If that is labeled, you have to tell why the beneficial effect is, why the initial few contractions are increasing in amplitude, then the contraction and decreasing. So whatever will be shown that decreased contraction, that is due to fatigue, but initial few contractions are more in amplitude, that is due to the beneficial effect. Oh, one is there. So this is this. Did not find it. This is that. What is this? Genesis of tetanus, clonus and tetanus. So we just summarize the curves. One, simplest one is simple muscle curve, which will be shown. You have to explain effect of temperature, beneficial effect, that is same strength of stimulus in relaxation phase or in contraction phase or in latent period. Maybe in the first half of latent period, some authors are making even describing first half of contraction period, second half of contraction period, relaxation period, just after the relaxation period, but mainly relaxation period, contraction period, latent period. So same strength, that is called the second contraction is greater in amplitude, that is the beneficial effect. Then is genesis of tetanus due to increased frequency of stimulus. Okay. Genesis of tetanus, genesis of fatigue, and the changes, and then the maximal supramaximal stimulus, the amplitude of contraction, what is maximal stimulus, that is one curve, that is one diagram, and the last one which we told is this velocity you have not done yet, it is genesis of fatigue. Yes, this is the effect of preload and afterloaded condition of muscle. So these are the curves may be shown. One is there which is sometimes asked, how do we measure the can we measure the velocity of conduction in the sciatic nerve? Yes, we can do if the stimulus is given. So stimulus is given at one end, nerve, that is where it is just attaching to the muscle, and at the other extreme of the nerve. If two stimuli these stimuli are separately given and measured, same strength of stimulus, one time it is given at one end of the muscle, free end of the nerve, and another at the just where the nerve is going to the muscle. Theoretically, you may say the neuromuscular junction, not physiologically, but theoretically the just at the where the nerve is attaching to the muscle. If this is given, then what is the distance? Then two times we can measure the latent periods. We'll see the latent period is varying, so we can measure the latent periods. And what is the distance? The distance is between the two ends of the nerve. So how it is measured? It is measured in the graph, the distance between the 2 points divided by the time, that is gives us the velocity of the conduction in sciatic nerve. So that can be also done experimentally by giving two separate stimuli of the same strength. Actually all these curves are so all these curves were one, this one also, these are stationary drum. When the drum is stationary, So these types of curves are, this is what is obtained. When the drum is stationary, when the drum is moving, then which one? All this is in case of moving drum, kymograph in case of moving drum. In stationary drum, these just the amplitude of contraction will be recorded by the writing apparatus. Just to show you the velocity of afterload in case of moving drum. What is happening as the weight is increasing, the amplitude of contraction is getting lower. That is, compare it with your knowledge of cardiovascular physiology. What you know, if the peripheral resistance is more, the heart has to work more to pump blood. This is a separate graph. If this is given, what is this? It is already written. What is this? Stimulus beneficial effect after relaxation period. So genesis of tetanus again can be shown like this. This is going to a sustained muscular contraction. Last one. If just this is given, you have to say tetanus. So usually it will, so all these will be given. This is the trape. If this is given, this will be told incomplete tetanus. I'll just show whether the velocity of conduction is there. Just open that page, velocity of conduction of sciatic nerve. There is nothing to show there, just explaining that. What is this showing? Indication of threshold stimulus, maximal stimulus and supramaximal stimulus. Same as this one. These and these two are the same. That is, the amplitude of contraction is not rising after a certain period when all motor units have been recruited. This is on stationary drum showing just the single line, and this is on moving drum. We have not done cardiac muscle still. This is already written, but just tell by seeing the diagram. After load, stationary drum. As the height of contraction, this is preload, stationary drum. If it is same thing, if it is moving drum, then the curve will be look like that what you have seen in simple muscle curve. If the if a single line is given, that will not be given. That is very, if this is recorded on a stationary drum, only one line will be there. Only one line. Height of this curve will not be there. Have you opened velocity of conduction now? So see, just read it out. See the curve. So two separate curves named as M and V. Named as M and V, two separate curves, because just M and V are for one, the nerve is stimulated at the muscle end, so it is named as M, and the nerve is stimulated at the vertebral end. Actually, we are not taking the vertebra, that is the other end, so that is named as the V curve. And distance between the, what is the distance to be taken here? The distance between this S and vertebral end and the muscle end of the nerve. That distance is made as how? Distance between the two pairs of the electrodes in the experimental setup. That is the same as the distance as the electrode. One electrode is applying to the vertebral end, one electrode is applying to the nerve end. So distance between the two pairs of electrodes is known to us. So that is that distance by the time. Time is, which is measured with the help of the, as in simple muscle curve, with the help of the this tuning fork. Oh, this is there, this one. It's not being, this is the, so measurement of velocity of nerve impulse. So one is the V curve. Why it is named as the V curve? It is shown, nerve is stimulated at the simple muscle curve by stimulating the nerve at the end, other end from which it is attaching to the muscle. In the experimental setup, we are not actually taking the vertebra to mount it. It is called it is obviously the vertebral end. That is, vertebral end means the nerve is going from the spinal cord to the muscle, actually from the spinal cord to the muscle. CNS is not done. Do you know what is lower motor neuron? Upper motor neuron, lower motor neuron terms you have heard in neuromuscular physiology. Have they been told? It will be discussed in CNS. Upper motor neuron is from the cerebral cortex to the center, where it is in case of say this, most of these our muscles of the hand, muscles of the leg. So it is controlled from the cortex to the spinal cord. It is the upper motor neuron, and the final pathway from the spinal cord to the muscle proper, say the biceps. From the spinal cord, which roots? Where from the cervical root. So from the spinal cord to the biceps, from the spinal cord say to the gastrocnemius, this is from the spinal cord to the thigh muscles, these are the lower motor neurons. And from the cortex to the spinal cord, these are the upper motor neurons. So they are called the corticospinal fibers, the upper motor neurons. Okay, so a nerve will be attached to the vertebral end and to the muscle end. So that is the lower motor neuron, one end of the lower motor neuron. All these nerves or this nerve muscle preparation we are talking about, these nerve neurons are lower motor neurons. Lower motor neurons, just from the name. Motor neuron supplying the muscle, lower, because this is anatomically in the lower part of the body, in the inferior part of the body, inferior than the upper motor neurons. So these are the lower motor neurons. Final common part. If lower motor neuron is gone, then the muscle can't work. Okay. So we'll discuss during CNS. Facial muscles have, so upper half, lower half have bilateral. We'll discuss them. So today, which we have discussed, just see them. How many did not attend last Tuesday? Three, four, five. একদিকে উঠে বেরিয়ে এসো তো, একদিকে যারা আগের দিন আসনি উঠে বেরিয়ে, কতজন আছে? 5-6 জন। লাস্ট টিউসডে কারা আসনি তারা এইদিকে চলে এসো, ওই দরজা দিয়ে, এখানে দাঁড়িয়ে দেখো। এটা হচ্ছে প্রথমটা, সিম্পল মাসল কার্ভ। চলে এসো, যারা আগের মঙ্গলবার আসনি এখানে চলে এসো। সবকটা দেখো, দেখেছো যেটা সিম্পল মাসল কার্ভ, দ্যাট ইজ দ্য ফার্স্ট ওয়ান। আর কিছু না পারলে ওইটাই জিজ্ঞেস করবে, হোয়াই ক্যান বি ফ্রগ, ফ্রগ কেন চোজেন। যদি 5 নম্বর আলাদা থাকে তাহলে ওই সিম্পল মাসেল কার্ভ না বলতে পারলে জিরো, মানে জিরোও বসতে পারে সেখানে। বাকিগুলো না পারলে অ্যাটলিস্ট সিম্পল মাসেল কার্ভ কোনটা লেটেন্ট পিরিয়ড, কোনটা কি পিরিয়ড, সেটা ডেসক্রাইব করতে হবে। টাইম ট্রেসিং এ কত টিউনিং ফর 100 হার্টজ এর ফ্রিকোয়েন্সি ইউজ করা হচ্ছে। এটা তো একই, স্টিমুলাস অ্যাপ্লাইড ডিউরিং সেকেন্ড হাফ, তাতে একটু বেশি হবে এটার থেকে, সেকেন্ড হাফ অফ লেটেন্ট পিরিয়ড। ওটা তো সেই ফিজিওলজিক্যাল কার্ভ হবে যেরকম হয়, সেটা দেখাইনি এখানে। ফিজিওলজিক্যাল কার্ভ তো হবে, ওইটা কিছু হচ্ছে না। এটার সাথে সিম্পল মাসেল কার্ভটার সাথে মিলিয়ে দেখো, যেখানেও দেখায়নি, এটার সঙ্গে হবে। ঠিক আছে, এগুলো দেখা হয়ে গেলে ওটা ওখানে গিয়ে আবার বসো, ওখানে যেগুলো দেওয়া আছে, যেগুলো আজকে নতুন বলা হলো সেগুলো আছে। এই পিকচারই থাকবে, মানে এইটাই পার্টিকুলার থাকবে কোনো মানে নেই। বইতে ছবি সব বইতেই পাবে, সব বইতে সব ছবি আছে, যে বই পড়ো না কেন। না থাকলে যদি একটা দুটো ছবি, সো বেটার হচ্ছে ওই একে জানের বইটা তাহলে লাইব্রেরি থেকে নিয়ে, যে কটা লাগবে সব কটা ছবি ওখানে আছে। জেনেসিস অফ টিটেনাসটা কে বলছিল সেদিন, ওই ডক্টর প্রামাণিকের বই পাচ্ছিল না, সো একে জানের বই, ডক্টর একে জানের বইটা নিয়ে তাহলে এ করে দেবে। বিশেষ করে লেখা তো থাকবে না, পরীক্ষায় হয়তো লেখা থাকবে না, এক্সটার্নাল তারা যদি নিজেদের মতো করে গ্রাফ নিয়ে আসেন সেখানে লেখা থাকবে না, জাস্ট তোমাকে ডেসক্রাইব করতে বলবে। এগুলো এখনো কার্ডিয়াক পড়ানো হবে, পরের নেক্সট উইক। তো তোমাদের তো এই শুক্রবারও ছুটি আছে, ঠিক আছে, নেক্সট উইক। বসো, বাকিগুলো ওখানে আছে, দেখো আরো তিনটে কার্ভ আছে। তো এই 8-10টা গ্রাফের মধ্যে আর কার্ডিয়াকের যেগুলো আছে অ্যামফিবিয়ান নার্ভ গ্রাফের মধ্যে যে নাম্বার থাকবে, সিম্পল মাসেল কার্ভ না পারলে তাহলে আর কোনো নাম্বারই সেখানে পাওয়া যাবে না, যদি আলাদা নাম্বার থাকে। আর যদি ইনক্লুডেড উইদিন ভাইভা, দেন দ্যাট উইল যা এফেক্ট হবে ভাইভার উপর। ভাইভাতে তো সঙ্গে নার্ভ মাসেল ফিজিওলজি থিওরিটিক্যাল কোশ্চেন থাকবে, মানে কোশ্চেন করা হবে। It is included within the viva. We try to include within the OSPI part. OSPI there will be MCQ type of questions. There will be some questions like physiological curve is due to inertia of liver, or mark the correct statement. 4 statements. So physiological curve is due to inertia of liver. The physiological curve is a separate contraction, so that is a false statement. Separate small contraction, that is not correct. Physiological curve is noted due to a separate lesser strength contraction, or physiological curve অথবা the second curve একটা দেওয়া থাকলো, this second curve, এটা simple muscle curve টা দেওয়া আছে, so you have to identify. So the second curve is due to a very small stimulus. No, that is the physiological curve, that is due to the inertia of liver. So that statement is wrong if it is given with the picture, or সেখানে কোনো লেটেন্ট পিরিয়ড নেই, সেখানে কিছুই নেই, সেটা একটা সেপারেট কার্ভ, মানে সেটা কোনো সেপারেট কন্ট্রাকশন নয়, বা বেনিফিশিয়াল এফেক্ট, হোয়াট এভার, জেনেসিস অফ ফ্যাটিগ, সো দ্যাট মে বি সেট অ্যাজ আ OSPI type of question. Or say if there is no diagram given in the OSPI, just statements are given, you have to mark the right statement or the wrong statement. If there are 2 marks, say 2 marks, so MCQ type question, 2 marks question, so maybe 5 options are given, mark the correct statement. So it may be mentioned, it may not be mentioned, there will be multiple options may be correct. So you mark A, B, C are correct, or A and B are correct, or B and D are correct. So both may be correct, not that one has to be correct. Usually in the theory papers, the MCQs are set like that. Usually it is set that mark the single best option. But if it is given mark the correct options, then maybe more than one option is correct. And you have to mark the correct options, obviously, that is not that if 2 options are correct, I mark all and say that those 2 are within my answers. That will not do. So you have to mark those 2 only. Actually, in case of multiple choice type, multiple options correct, what should the rule be? If you mark 3, then you do not get any mark. That means you are trying to say if you mark all, then obviously those 2 will be within those all. So you have to mark 2. If 2 options correct, you have to mark 2. So usually we say during the question it is mentioned 2 of the options are among these statements, 2 are not correct. Identify them. So you have to mark 2. Either you do A and C, or A and D, or B and D, not B, C, D. So B and D is within my B, C, D. Like that, then you get no mark. You have to mark 2 and you have to mark that category. Opposite you can do, you mark 1. It is already written in the question, identify the 2 wrong statements among the following. So you mark 1, if that is among the wrong statement, you get at least 1 mark. But not that you mark all and say those 2 are within this. Or I mark 3, so the chance increases. And whenever it is single best option is MCQ, then also what is the better way to approach an MCQ? Some are factual MCQs, some are factual MCQs, we have nothing to do, that we have to know that, say, example from what has been taught, say, resting membrane potential of this muscle tissue or muscle cell, or resting membrane potential of this type of cell, neuronal cell, is minus 90 millivolt, minus 75 millivolt, these options are given, plus 35 millivolts, so that is obviously wrong, minus. So this is, so if that is given, then mark single option, so that is factual type of question, it has nothing to analyze here, so you know the answer, you mark them. But whenever the MCQ is analytical, or you have some this kind of, you have to apply some intellect, you have to decipher it, then it is always good to first discard what is ever not possible. So, say the total body water in a 70 kg weight human body, 70 kg weight human body, total body water. So, the options are given, say 42 liters, 28 liters, 5 liters and 100 liters, 140 liters. So, 5 liters is, you mark, this is obviously, this cannot be, even if you are confused between this 28, 42, 5 liters it cannot be. So, as I rule out, 5 liter is the amount of, just the amount of blood, 3.5 liters is the amount of plasma. How can be that the total body water? It has to be much more than that. So, that is obviously a wrong option. So, as you eliminate one option, chances of getting correct are more. If you have to mark, just blindly mark one of the 4 options, then chances of getting correct, you know nothing, somebody knows nothing about that MCQ, just mark. Negative marking is not there. So, I have to mark one. So, getting correct is 25%. But if I can rule out one, then chances of getting correct becomes 33.3%. If I can rule out 2, then chances of getting correct become 50%. And if I can rule out the rest 3 analytically, even if I don't know, if I don't know about the other option. So, mark the correct statement if one is correct. If I know that 3 are wrong, but I do not know anything about the another one, but that has to be correct. If I am sanguine that the other statements are wrong, or mark the wrong statement if I know that the other 3 are correct, I am confused whether this is correct or wrong, so that is obviously wrong. So, we get to the answer. Even if we can eliminate 2 incorrect options, then also the chance is 50-50. So, the way to tackle MCQs is like that.